stop for a second. If you have ever woken up, checked your blood sugar, and wondered how it could possibly be higher after a full night of not eating anything, what I am about to explain may completely change how you think about your body. For more than 20 years as a surgeon, I watched patients do everything they were told to do. They cut sugar, they counted carbohydrates, they followed strict meal plans. They took every medication exactly as prescribed. And yet, morning after morning, their glucose numbers kept creeping up. Higher than expected, higher than last year, sometimes higher than the night before. And the most frustrating part? Many of them were doing everything right. Now, here's the part most people never hear. You are not failing your body, and your body is not randomly betraying you. In many cases, the real problem is happening quietly while you sleep. All night long, your body is releasing small amounts of glucose into your bloodstream to keep your brain and organs functioning. This process is completely normal. In fact, it is necessary for survival. But in millions of people, something subtle begins to change inside the cells that are supposed to respond to insulin. The signal arrives, but the cells stop listening. Not because of a slice of bread you ate yesterday, not because you skipped a workout, but because the environment surrounding those cells slowly changes over time. Inflammation builds, cell membranes lose flexibility, and the delicate communication system that controls blood sugar begins to break down. Here's the surprising part. Some of the most powerful ways to support that system do not start with medications or complicated diets. They start with something far simpler, something most people already have in their kitchen. Certain natural oils contain compounds that directly influence inflammation, cellular signaling, and the way your body responds to insulin overnight. Used correctly, they can help support the exact systems that determine whether you wake up with stable glucose or a number that leaves you frustrated before the day even begins. And today, I am going to walk you through three specific oils that researchers have been studying for their impact on blood sugar regulation, metabolic health, and insulin sensitivity. The third one, in particular, has produced results that surprised even experienced clinicians. So stay with me because by the end of this video, you may start looking at your morning glucose readings very differently. I am Dr. Megan Foster. I spent over 20 years working as a surgeon, treating patients dealing with cardiovascular disease, metabolic conditions, and the long-term complications that develop after years of blood sugar imbalance. Complications that, in many cases, could have been slowed or even avoided with better early information. And in all of that time, one pattern became impossible to ignore. Most people are working on the wrong problem. They are told to focus almost entirely on what they eat, cut the sugar, reduce the carbs, avoid fruit. And while those dietary adjustments have their place, they miss the deeper issue entirely. Blood sugar problems are not just about sugar intake. That is the oversimplified version of the story. The real drivers are often things like chronic inflammation, quietly building inside blood vessels and tissues over years. Cells that have gradually lost their sensitivity to insulin, not because of one bad meal, but because of sustained inflammatory pressure over time. A progressive breakdown in the very systems that are supposed to be absorbing and managing glucose efficiently. And in many cases, a liver that is not releasing stored glucose the way it should overnight, which means something that very few people are ever told. Sometimes the difference between stable blood sugar and unstable blood sugar is not simply about removing foods from your plate. Sometimes it is about actively supporting the biological systems that process and regulate glucose, giving those systems the right raw materials so they can do the work they are designed to do. And that is exactly where certain dietary fats have started attracting serious and growing scientific attention. Now, before we go any further, I want to check in with you. If you are comfortable, drop your first name and your age in the comments below. One of the most encouraging things about conversations like this is seeing how many people across so many different decades of life are actively working toward better metabolic health. 30-year-olds trying to get ahead of a family history, 50-year-olds who are seeing numbers shift for the first time, 70-year-olds who want to protect their cardiovascular health for the years ahead, all asking the same questions, all doing the work. If you take a moment to scroll through the comments, you will quickly realize you are not alone in this. All right? Let me explain what is actually happening inside the body when blood sugar becomes difficult to manage. And I am going to do this without complicated medical terminology because this concept should be clear to everyone, regardless of your background. Think of glucose regulation like traffic moving through a city. Glucose is the fuel, it is the cars on the road. Every time you eat, more cars enter the city. Your body needs to direct those cars efficiently to the right destinations, mainly into your muscle cells and your liver, where the energy can actually be used and stored properly. Insulin is the traffic signal system. It is what tells the cells throughout your body to open their doors and let the fuel inside. When everything is working properly, the signals are clear. Traffic flows. Cars reach their destinations. Energy gets used. The whole system runs smoothly. But here's what happens when inflammation begins to build up inside the body over months and years. The traffic signals start to malfunction. The cells begin to stop responding to the signals the way they should. The doors stay closed even when insulin is knocking on them. So glucose, the fuel, keeps circulating in the bloodstream instead of entering the cells where it belongs. It builds up, it piles up, like gridlock spreading through the entire city. That buildup is what shows up as elevated blood sugar on a test. It is not necessarily that there is too much fuel entering the city. It is that the fuel cannot get where it needs to go because the communication and routing system is breaking down. So, the goal is not just reducing how much fuel enters the city, the goal is repairing the traffic signal system, restoring the responsiveness of the cells, reducing the gridlock, getting the whole system communicating clearly again. And this is precisely where the research on certain dietary compounds starts to become genuinely important. Here is something that most people do not realize about inflammation. It does not announce itself. There is no fever, no obvious pain. Low-grade chronic inflammation is quiet. It operates in the background of your biology for years, sometimes decades, without producing symptoms you can easily identify. And all the while, it is slowly changing how your cells respond to the signals your body sends them. By the time the numbers on a test reflect the problem, the process has often been underway for a long time. This is why nutritional strategies that target inflammation can matter so much more than they appear to. You are not just changing a number, you are addressing one of the actual root causes of why those numbers shifted in the first place. Large nutritional studies conducted over many years have consistently shown something fascinating. Populations that follow Mediterranean-style diets, diets that are rich in specific plant oils, natural fats, abundant vegetables, and whole foods, show significantly lower rates of metabolic problems and type 2 diabetes compared to populations consuming more processed and inflammatory dietary patterns. One major long-term study involving more than 7,000 participants found that diets centered around healthy plant oils produced meaningful, measurable improvements in markers related to metabolic health and how well the body uses insulin. Not because of one single ingredient, not because of one dramatic dietary change, but because specific nutrients were consistently supporting the systems responsible for keeping metabolic balance functioning the way it should. Now, here is something that I think deserves its own moment. Think back 10 or 15 years. Think about the morning routine you had back then. Did you ever wake up and immediately worry about your blood sugar? Did you check a number before you even put your feet on the floor? For most people, the answer is no. You ate dinner, you went to sleep. Your body handled the overnight process quietly. You never thought about it. But today, millions of people wake up, and the very first thing they do is check a number. And that number does not always match the effort they put in. It does not always reflect the careful choices they made the evening before. And that disconnect between the effort and the outcome, is genuinely one of the most demoralizing parts of dealing with blood sugar instability. It leads people to feel like something is fundamentally broken inside their body. Like no matter what they do, it is not enough. Like the battle is already lost. But here is what I need you to hear clearly because this is one of the most important things in this entire conversation. This shift is not inevitable and it is not irreversible. Your metabolism is not a fixed machine that simply wears out on a schedule. The pathways that regulate blood sugar are dynamic. They respond to inputs. They adapt to the environment you create for them. Nutrition, sleep quality, physical movement, the inflammatory load you are carrying or reducing, the specific compounds you consistently provide through the foods you eat. All of these things send signals to your metabolic systems every single day. And your biology listens. This is the foundational principle behind what we are discussing today. In a moment, I am going to walk you through three specific oils that researchers have studied for their potential role in supporting insulin sensitivity, reducing the inflammatory pressure that disrupts glucose regulation, and improving the way cells receive and respond to metabolic signals. The first oil is widely known, but most people are not using it in the way that makes it most valuable. The second one genuinely surprises most people when they hear about it. Most people in Western countries have never considered it at all. And the third is considered by many researchers to be one of the most powerful plant based sources available for supporting metabolic and inflammatory balance over the long term. Stay with me because we are going through each one in real depth, not just the names, not just the headlines, but what the research actually shows why they work the way they do inside the body and exactly how to incorporate them practically into your daily routine. Let us start with number three, extra virgin olive oil. Now, most people hear olive oil and immediately think of it as just a healthier cooking fat, a better alternative to processed vegetable oil or butter, something you drizzle on a salad or use to saute vegetables. And while that is accurate, thinking about it that way misses what makes extra virgin olive oil genuinely significant from a metabolic standpoint. The key compound inside extra virgin olive oil is something called oleic acid. It is a monounsaturated fat, which simply describes the structure of the fat molecule. But what matters here is not the chemistry. It is what oleic acid actually does once it is inside your body. Your cells are surrounded by membranes, every single cell in your body. Think of a cell membrane like the outer wall of a building. Everything that enters or exits the cell has to interact with that wall in some way. And the quality of that wall is not fixed. It is directly influenced by what you eat, because the fats you consume get incorporated into those membranes. When your cell membranes are built with healthy fats like oleic acid, they remain flexible and fluid. They function the way they are designed to function. And this matters enormously for blood sugar regulation because insulin receptors, the tiny structures embedded in those membranes that receive insulin signals, work far more effectively when the surrounding membrane is flexible and healthy. When the signal arrives and the membrane is in good shape, the receptor responds. The cell opens its door, glucose enters, energy is used, the traffic flows. When the membrane is stiff, rigid, or composed of lower quality fats from processed foods, those receptors struggle to do their job properly. The insulin signal becomes harder to receive. Cells become less responsive over time. This is a direct structural contribution to insulin resistance that most people never hear about. Now, here's where it gets more significant. This membrane flexibility applies not just to muscle cells in your arms and legs, but to cells in your liver, your fat tissue, and your blood vessel walls. Every cell that participates in glucose management is affected by the quality of fats in its membrane, which means the impact of oleic acid is system-wide, not localized to one tissue or one organ. But oleic acid is only part of what makes extra virgin olive oil interesting. High-quality extra virgin olive oil also contains a family of compounds called polyphenols. These are natural plant antioxidants. What they do is help protect the interior of your blood vessels from oxidative stress, which is essentially a form of slow, ongoing cellular damage that accumulates in tissues over time. Oxidative stress is one of the key mechanisms that drives both chronic inflammation and the gradual development of insulin resistance. There is also a specific polyphenol found in extra virgin olive oil called oleocanthal that researchers have been studying closely. Oleocanthal has been shown to have anti-inflammatory effects that work through some of the same biological pathways as common anti-inflammatory medications, but in a gentler, food-based way. The fact that a single oil influences inflammation through multiple different compounds simultaneously is part of why the research on it is so consistent. One study published in the Journal of Clinical Nutrition found that diets consistently rich in extra virgin olive oil improved what researchers call endothelial function, which refers to the health and responsiveness of the inner lining of blood vessels. It also improved several markers directly connected to metabolic health and insulin sensitivity. The effect was not dramatic or immediate, it was cumulative and consistent, which is exactly the pattern we see with meaningful nutritional interventions. Here's the practical side of this: extra virgin olive oil does not require dramatic changes to how you eat. Drizzle it over roasted vegetables after they come out of the oven. Use it as the base for salad dressings. Finish cooked grain dishes with a light drizzle before serving. Combine it consistently with fiber-rich foods because dietary fiber slows the absorption of glucose and the two work synergistically together. But there is one common mistake that people make with high-quality olive oil that quietly destroys many of its most beneficial properties: overheating it. Extra virgin olive oil has a relatively low smoke point compared to refined oils. When you heat it past that threshold, you break down the delicate polyphenol compounds and some of the oleic acid properties that make it metabolically valuable. For high heat cooking methods like frying or high temperature roasting, a different oil is more appropriate. For dressings, cold applications, moderate heat, and finishing dishes, extra virgin olive oil is excellent. And quality matters here. The label extra virgin is not always regulated consistently, so look for oils that have a harvest date on the bottle, preferably within the last 12 months, and that come in dark glass bottles to protect the polyphenols from light degradation. Consistency is the critical factor. A tablespoon or two daily, used regularly as part of your overall dietary pattern, is where research suggests the meaningful benefits begin to compound. Not occasional use. Regular, daily incorporation. All right, let us move to number 2. And this one genuinely catches people off guard: black seed oil. Most people in Western countries have never heard of this, but black seed oil has been used in traditional medicine systems across the Middle East, South Asia, and North Africa for over 2,000 years. And in recent decades, modern nutritional science has started taking it seriously. Black seed oil comes from a plant called Nigella sativa. The seeds from this plant are sometimes also called black cumin or kalonji, depending on the region. The oil extracted from these seeds contains a particularly remarkable compound called thymoquinone. Thymoquinone is the compound that keeps showing up in research studies on black seed oil. Multiple published studies have demonstrated that it has strong anti-inflammatory and antioxidant properties. And given what we have already discussed about how chronic inflammation disrupts insulin signaling and damages the traffic signal system in the body, reducing that inflammatory burden through nutritional support may meaningfully improve how well cells respond to insulin over time. But what makes black seed oil especially interesting in the specific context of blood sugar is a more targeted mechanism. Some research suggests that thymoquinone may influence how the liver manages and releases stored glucose, particularly during the overnight fasting period. And this is directly relevant to one of the most frustrating experiences for people managing blood sugar, which is waking up to an elevated reading after hours of not eating. Here is why this happens and why it matters. Diet Your liver stores glucose in a form called glycogen. Think of it as a glucose reservoir. Overnight, while you're not eating, the liver is supposed to release glucose gradually and steadily to maintain your energy and keep blood sugar stable while you sleep. In people with healthy metabolic function, this process is tightly regulated and precise. But in people with insulin resistance or significant metabolic inflammation, this overnight release process can become dysregulated. The liver releases too much glucose too quickly or continues releasing glucose when it is not needed. This is one of the primary reasons why morning fasting blood sugar readings can be elevated even after 8, 9, or even 10 hours of fasting with no food intake at all. There is also something else happening in the liver called gluconeogenesis. This is the process by which the liver creates new glucose from non carbohydrate sources like amino acids. In a healthy system, this is carefully controlled. But when inflammation is high and insulin resistance is present, the liver can produce and release glucose through this pathway, even when blood sugar is already elevated. It is the liver continuing to add fuel to a road that is already gridlocked. When metabolic inflammation decreases, both the glycogen release and this glucose creation process tend to regulate more naturally. And this dual mechanism may help explain why some people who use black seed oil consistently report improvements in their morning fasting readings specifically. I want to be careful and precise here because accuracy matters more than enthusiasm when it comes to health information. The research on black seed oil and blood sugar is genuinely promising, and it is growing. But in terms of volume and long term consistency of evidence, it is not yet at the same level as the research behind omega 3 fatty acids or olive oil. The science is developing actively and the direction is encouraging, but it is important to understand where the evidence currently stands. What the evidence does support clearly is that thymoquinone has real anti inflammatory effects, and that the overall metabolic impact of black seed oil is a legitimate and scientifically supported area of investigation. Practically speaking, black seed oil is used in small amounts. Half a teaspoon to 1 teaspoon daily is the range seen most commonly in studies. The flavor is quite distinct. It has a sharp, somewhat peppery, slightly bitter taste that some people enjoy immediately and others need several days to adjust to. Most people take it by stirring it into a small amount of warm water or diluted juice, or by adding it to a smoothie or salad dressing. Very small amounts taken consistently are more beneficial than larger amounts taken irregularly. One important practical note: if you are currently taking any prescribed medication for blood sugar management, please consult your doctor before adding black seed oil to your routine. Any nutritional compound that influences glucose and liver metabolism should be introduced carefully and with medical awareness, particularly when medications are already in the picture. The theme with all three of these oils is the same. Consistency over time is the mechanism of benefit, not dramatic doses, not short term experiments, steady, regular incorporation into your daily nutritional pattern over weeks and months. Now we are moving into the final oil, and this one sits in a different tier in terms of the depth and breadth of scientific evidence behind it. Many researchers and metabolic nutrition experts consider what we are about to discuss to be among the most thoroughly studied natural compounds available for supporting both metabolic and cardiovascular health. The evidence here is not preliminary or emerging. It is deep, wide, and built across decades of research in multiple countries and multiple populations. Flaxseed oil. Flaxseed oil is one of the richest plant-based sources of omega-3 fatty acids available to us. Specifically, it is exceptionally high in a form of omega-3 called alpha-linolenic acid, commonly abbreviated as ALA. You may have heard about omega-3 fatty acids primarily in the context of fish oil or heart health. But plant-based omega-3s from flaxseed operate through several of the same core pathways and bring specific benefits that are directly and meaningfully connected to blood sugar regulation and long term metabolic function. Here's the primary mechanism. Omega 3 fatty acids play a direct role in regulating inflammatory signaling throughout the body. They do this at a fundamental molecular level, influencing the production and activity of compounds that either promote or suppress inflammation throughout tissues, blood vessels, and organs. This is not a vague or general effect. It is a specific, well documented biological mechanism. And inflammation, as we have now discussed from multiple angles, is one of the most important underlying drivers of insulin resistance. When the body is carrying a sustained burden of inflammatory activity, cells throughout the body become progressively less responsive to insulin. The communication between insulin and the cell degrades. Glucose absorption becomes less efficient. Blood sugar becomes harder to stabilize. And over time, the entire regulatory system begins to lose precision. When omega 3 intake is adequate and consistent, inflammatory signaling across the body tends to moderate. The cellular environment becomes more favorable for insulin to function properly. And critically, these effects compound with consistency over weeks and months of regular intake. But there is a second mechanism with flaxseed oil that is equally important, and it connects directly back to something we discussed earlier when talking about olive oil. Omega 3 fatty acids get physically incorporated into the membranes of cells throughout the body. When cell membranes are rich in omega 3 fats, the insulin receptors embedded in those membranes tend to function more efficiently and more responsively. The communication between the insulin signal and the interior of the cell improves. Glucose can be absorbed more readily and more consistently. Think of it this way, using our building analogy from earlier. If your cell membranes are the outer walls of a building, and insulin receptors are the entry doors in those walls, then having omega 3 rich membranes is like ensuring those doors are well maintained, well functioning, and easy to open when insulin arrives and knocks. The signal arrives. The door responds properly, the fuel enters. The system does what it is supposed to do. There is also a third dimension to flaxseed oil worth understanding. It relates to body fat, which is not passive storage. Fat tissue is a metabolically active organ that produces hormones and signaling compounds of its own. When fat tissue becomes inflamed, it begins releasing compounds that actively worsen insulin resistance throughout the body. Omega 3 fatty acids have been shown to help reduce inflammation within fat tissue specifically, which improves the overall metabolic environment across the whole body. The benefits extend well beyond cell membranes. Several metabolic research studies have shown that regular omega 3 intake supports healthier lipid profiles, meaning better cholesterol balance and lower triglycerides, and supports more favorable inflammatory markers over time. Both of these outcomes are directly connected to long term blood sugar stability and cardiovascular health. They are not separate benefits, they are part of the same connected metabolic picture. Now, there's a critical practical point about flaxseed oil that you absolutely must understand before you go out and buy a bottle. It should never be heated. This is non negotiable. Unlike olive oil, which can tolerate moderate cooking temperatures, flaxseed oil is extremely sensitive to heat. The omega 3 fatty acids in it begin to break down at relatively low temperatures, and heating can produce compounds that are actively counterproductive. This means flaxseed oil should only ever be used cold, added to a smoothie, drizzled over a finished dish after it has come off the heat completely, stirred into yogurt, mixed into a cold salad dressing, used as a finishing oil over cooked vegetables that have already cooled slightly. Never for cooking, never in a pan, never in a hot dish, always cold. Storage also matters significantly with flaxseed oil. It should be kept in a dark glass bottle, refrigerated at all times, and used within a reasonable time after opening because it oxidizes relatively quickly when exposed to light, heat, and air. Oxidized oil not only loses its benefits, it can have a negative effect. Check the expiration date and trust your nose. Fresh flaxseed oil has a mild, slightly nutty smell. If it smells sharp or unpleasant, it has oxidized and should be replaced. 1 to 2 tablespoons daily in cold applications is a practical and effective amount. You do not need large quantities to benefit meaningfully from its omega 3 content. Small amounts used consistently every day is the right approach. Now, I want to take a moment before we close to address something important, because this conversation would not be complete without it. Everything we have discussed today, extra virgin olive oil, black seed oil, and flaxseed oil, these are nutritional compounds found in food. They are not treatments. They are not medications. They are not cures for any condition, and they should never be presented or understood as such. If you are currently managing blood sugar with prescribed medication, you should never adjust, reduce, or stop that medication based on anything you see or hear in a video. Always work with your doctor. Always communicate any meaningful changes you are making to your diet, including adding new oils or supplements. And always monitor your levels carefully during any period of dietary change. What these oils represent is nutritional support for the systems that are already involved in metabolic regulation. They are tools that can work alongside medical care, not replacements for it. The goal is to give your body better raw materials, not to treat a medical condition without professional guidance. With that clearly said, let me pull back and show you the larger picture that ties all three of these oils together. Because the real takeaway today is not about the individual oils, it is about the underlying principle they share. All three of these oils work through overlapping but distinct mechanisms on the same three core biological systems that are central to long term blood sugar stability. The first is insulin sensitivity, how well your cells actually receive and respond to the insulin signal. Oleic acid from extra virgin olive oil supports the flexibility and health of cell membranes where insulin receptors live. Omega 3 fatty acids from flaxseed oil support how efficiently those receptors communicate with the interior of the cell. Both of these directly influence how well insulin can do its most fundamental job. The second is inflammation control. Chronic low-grade inflammation is arguably the single most significant underlying driver of long-term blood sugar instability. It is not loud. It does not cause obvious symptoms in its early stages. It builds quietly in the background over years, and all three of these oils address it from slightly different angles. Thymoquinone from black seed oil has direct anti-inflammatory activity. Omega 3 fatty acids from flaxseed oil regulate inflammatory signaling at a foundational level. Polyphenols from extra virgin olive oil protect blood vessel tissue from the oxidative damage that drives inflammation. Different pathways, same outcome. The third is vascular and circulatory function. Blood sugar regulation depends on healthy, responsive blood vessels. Glucose needs to be transported efficiently through the bloodstream. Insulin needs to reach cells throughout the body. Polyphenols from olive oil support the health of the inner lining of blood vessels. Omega 3 fatty acids support vascular flexibility and healthy lipid balance. This dimension of metabolic health is often overlooked in conversations focused on diet and blood sugar, but it is a critical part of the full picture. When you see it this way, these three oils are not random choices. They are each addressing a real, specific, scientifically supported aspect of the same underlying challenge, which is why they keep appearing in metabolic research, in different studies, in different countries, in different populations, with consistent patterns of benefit. Now, I want to add one more layer that I think is genuinely important for understanding why dietary patterns matter more than individual meals. There is a concept in metabolic nutrition called cumulative dietary signal. It simply means that what matters most for your metabolic health is not what you eat on any single day. It is the consistent pattern of what you eat over weeks and months. Your cells, your membranes, your inflammatory pathways, they do not respond to one meal. They respond to the average of hundreds of meals. This is why studies on Mediterranean-style diets show such strong results. It is not because any single food is miraculous. It is because the entire dietary pattern, applied consistently, keeps sending the right signals day after day. extra virgin olive oil, omega-3 rich foods, anti-inflammatory plant compounds. All of it working together, all of it adding up. Adding these three oils to an already reasonable dietary pattern is like reinforcing a foundation that is already standing. You are not starting from scratch. You are strengthening what is already there. Let me give you something concrete to do with all of this. For the next 30 days, choose just one of these three oils to start with, not all three at once. Pick one, incorporate it consistently, and give your body time to respond. If you choose extra virgin olive oil, make it your primary finishing and dressing oil. Over salads, over cooked vegetables, over whole grain dishes. Aim for a tablespoon or two daily and make it a non negotiable habit rather than an occasional addition. If you choose black seed oil, start small and build gradually. A quarter teaspoon daily for the first week, then half a teaspoon. Give your palate time to adjust to the distinct flavor. Consistency over a full 30 days is what matters here, not quantity. If you choose flaxseed oil, add it cold into your daily routine, into a morning smoothie, into a salad dressing, drizzled over a finished dish before you eat it. Keep it refrigerated and in a dark bottle. Use it every day without exception. While you are experimenting, pay attention to a few things: your energy levels during the day and especially after meals. Whether you experience intense hunger or strong cravings between meals, your overall sense of steadiness and evenness throughout the day. And if you have a way to track it, your glucose patterns across the 30-day window. You are not looking for dramatic overnight change. Metabolic change does not work that way. What you are looking for is a quiet but consistent shift in how your body feels and how it responds. Subtle improvements that build over time. And I want to address something that comes up often when people start making nutritional changes like this. Many people expect to feel a clear difference within the first few days. And when they do not, they conclude that what they are doing is not working. They stop. They move on to the next thing. And the cycle repeats. This is one of the most common reasons why nutritional strategies that have real science behind them fail to deliver results in practice. Not because the biology is wrong, but because people stop before the biology has had enough time to respond. Think about what we have been discussing: oleic acid from olive oil, improving the composition of cell membranes; omega-3 fatty acids from flaxseed oil being incorporated into those same membranes over time; thymoquinone from black seed oil, gradually reducing the inflammatory burden that has been building for months or years. These are not fast processes. Membranes rebuild over weeks. Inflammatory pathways shift over months. The body does not undo years of gradual imbalance in a few days. So, if you commit to this 30-day experiment, commit fully. Do not judge it at day 5 or day 10. Track how you feel at the end of the full 30 days. Look at the full picture: energy, hunger patterns, glucose readings if you monitor them, sleep quality. The cumulative picture across a month is far more informative than any single day. And if after 30 days you feel there is something worth continuing, add a second oil. Give it another 30 days. Build gradually. That is how lasting metabolic improvement actually works. And here's the thing about metabolism that I believe is one of the most important things I can leave you with today. Your body is far more adaptable than the medical system sometimes makes it seem. Metabolic function does not simply deteriorate on a fixed schedule. It responds to the inputs and signals you give it, the foods you eat consistently over time, the quality of rest and sleep you provide, the physical movement you engage in, the inflammatory burden you reduce or allow to build, the specific nutritional compounds you supply or withhold. Small daily choices made consistently over weeks and months shape those systems more powerfully than any short-term dramatic intervention. This is not motivational language. It is simply how the biology works. The body is always listening to the signals you send it, every meal, every day. The question that matters is what signals you are choosing to send The three oils we discussed today, extra virgin olive oil, black seed oil, and flaxseed oil, each send specific and meaningful signals to the systems involved in metabolic regulation. Not miracle signals, not magic, just real nutritional support for real biological processes that are already doing their best to work properly for you. That is the whole point of this conversation. Not to replace your medical care, not to promise outcomes, but to help you understand the tools that are available to you and to give you a clear, science grounded framework for using them. Before you go, I want to mention one more thing. If today's conversation connected with you and you want to go deeper on long term metabolic health and healthy aging, I have put together a longevity guide that walks through a broader set of simple science based habits connected to metabolism, cardiovascular health, and the daily choices that compound meaningfully over years. The link is in the description below. And in the next video, I am going to walk through one extremely common cooking habit that most people use without thinking about it. One that research suggests may be quietly worsening blood sugar spikes after meals without people realizing it at all. It is one of those things that once you understand it, you genuinely cannot unsee it. So make sure you do not miss that one. Until then, take good care of your health. I will see you in the next discussion.